morning, everyone. How are you? My name is Abbie Cornett, and I am the patient advocate for IG Living Magazine. I see some faces from the last lecture, so I'll just cover a couple things real quick. IG Living Magazine is a magazine for patients that receive immunoglobulins for multiple different disease states. We frequently have articles on myositis and other diseases that require immunoglobulins. But beyond that, I do patient advocacy for patients with chronic and rare diseases. I was asked to give this morning's lecture on Social Security disability and how some of the requirements for it and what it covers. First thing I learned was you don't make PowerPoints nothing but words. Okay? This PowerPoint is nothing but words. And that's just the way it is, because as I was making this up, I'm like, I just can't go bullet point. Because one, it's going to be on the website, and you're going to want to refer back to information that's here. So you're going to see a lot of words and descriptions. And that's for your future reference if you want to go back onto the Myositis website and look at it. We'll go over it, and anytime you have a question during the lecture, put up your hand, we'll stop, we'll try and figure it out together, okay? First, Social Security programs. There are two disability programs. There's what's called SSDI, which was implemented in 1956, and there's SSI, which was implemented in 1974. The definition for Social Security, what you need for Social Security disability benefits, we will go over first. But Medicare, you must be defined as disabled. Income and resources are not necessarily a factor. Benefits are based on individual lifetime Social Security earnings up to a maximum amount. Social Security disability insurance benefits for you and your family means you are insured. It's different than SSI. This fee is like Social Security. You have paid in a certain number of quarters that has been taken out of your paycheck, and this is a benefit that you receive. Federal Old Age Survivors Disability Benefits Insurance. This is just a little bit of history. This is if you want to go over, figure out where it came from, who it was originally intended for, and how it got started. It was a really interesting read. I know how SSI works. I didn't really realize how it had evolved over the course of years. We're going to talk about Medicare and how it works with it. If you get Social Security disability, you probably have Medicare or in a 24-month waiting period until you get Medicare. You are considered covered under the health care law and don't have to pay a penalty for not enrolling while you're under that 24-month period. Here's some exceptions to that. For any disability program, you have to be found disabled. There is a specific criteria for what disabled means. The law defines a disability as the inability to do any sustainable, gainful activity by reason of a medical determinable physical or mental impairment. It has to be for a continuous period of not less than 12 months. This doesn't necessarily apply to myositis, but Social Security disability is something that you can go on and come off of. Sometimes people with cancer go on Social Security disability for a period of time, and then they are able to return to the normal workforce or go off Social Security disability. When evaluating your claim, the Social Security takes into account these conditions, these 5 things. The severity of your condition, your age, your education, your past work experience, your transferable skills, and whether you're able to do any other substantial activity. I had the question earlier regarding something similar to this. I'll give you an example. I had an employee that worked for me as a lineman, stringing high power wires. He had very bad MS. He got to the point that he had to have an electronic boot to lift his foot. Until that time, he was able to do his job. At that point, it wasn't safe for him to do his job any longer, and as his employer, I worked on putting him on long-term disability, which he had paid into insurance for, until he could get onto Social Security disability. One of the things they looked at is, can he transfer to another job inside of the city? Meaning, transferable skills. Could I put him in a computer and have him do something? No. Was there any way to accommodate him in his current job description or what he was trained for? There was no way to accommodate a lineman with multiple sclerosis. What was your name? I'm sorry.
Alexis.
Alexis asked me a question. She wants to apply for Social Security disability, or her doctor saying she's at that point. How does she get, what does she do between the period that she has been determined by her doctor to not be able to work any longer and the period of time it takes to get Social Security disability? She's fortunate enough to have a long-term disability plan. You get approved if you have long-term disability for the long-term disability through the insurance plan that you have while you're working on the Social Security disability. During that time period, though, you have to make sure that your doctor says you can no longer do your functions or your job. And while you're on your long-term disability through work, you cannot probably get another job. They will disqualify you immediately for that. Social Security disability is available for individuals who are injured, or insured, excuse me. This means you must have an earnings record. There are two kinds of Social Security disability. SSDI, which you've paid into, and SSI, which is Social Security disability just without the insurance. You have to have worked 5 out of the last 10 years or 20 out of the last 4 quarters before you can be claimed disabled under SSDI. To receive SSDI, you must have worked. You must have worked a percentage of time, and you must have paid in to so many quarters. You can get Social Security disability under the age of 30 if you've paid in for enough quarters. It will be very difficult, and the amount will not be enough. There are ways you can get both SSDI and SSI if you show financial need. This again is more for the website when you go back on and to look at it, because these are requirements. There is no limit on your assets for SSDI. So, say for instance you're in your 50s, you're fully disabled, they determine that you need Social Security disability, you own a $300,000 home. You don't have to sell your house to get SSDI. You can have assets. You can return to the workforce and earn income. You cannot earn too much income, but you don't have to stay at home. And this doesn't really apply to myositis patients, but there is job training, retraining available under SSDI. The lineman I was speaking to went back, received workers training from the government, learned how to program, and return to the workforce. Not full-time to the workforce, but return to the workforce, because the training was available. If you can return to the workforce, myositis tends not to be one people, when they become disabled, return to the workforce with. Myositis and Social Security disability. There's what's called the Blue Book, which lists all of the qualifying disorders for Social Security disability. There are illnesses which are listed by the Social Security Administration as being so severe that they qualify you as medically for disability as a matter of law, without considering your age, your education, or your work experience. Myositis is covered in the SSA's Blue Book of medical listings under section 14.00. The Blue Book is a listing of disability conditions used by the Social Security Administration.
Question?
Yes?
I saw that in the Blue Book, they had a PN and DN listed, they did not have IBN listed.
Nope, they do not. It falls, we're going to go over that real quick.
Okay.
And there's a slide that's just blank that says IBM. There's kind of a reason I delved into that a little bit because I work primarily with immune deficiency patients, so I know the Blue Book in and out for immune deficiencies. I know myositis, learned a lot more in the past couple of weeks, I'll tell you. Dermatomyositis is included in the Social Security Administration book under section 14.05. You may qualify for benefits, and this is what the requirements are. Again, this was for the website. They're pretty stringent. You have to have had the diagnosis using the muscle biopsy. The individual must also suffer muscle weakness in the pelvis area, shoulders, resulting in the inability to effectively perform movements. As defined. Your doctor is the one that's going to help with this. They can also be included if they have suffered from impaired swallowing with aspiration due to muscle weakness, involved with conditions and symptoms which include impaired breathing, diaphragm muscles weakness, and diffused calcium with limited joint mobility. Like I said, lots of words in this presentation because we're dealing with federal law. And there's no way to make it easy or fun. It's just, it is what it is. Section 14.05 goes through limitations of daily activity, limitations in maintaining social functions, limitations in completing the tasks in a timely manner. These are all points when you apply for Social Security disability for myositis that need to be followed. Polymyositis, also defined under section 14.05. Criteria, though, is a little bit different. You can all read that on your own, but again, it goes back to weakness, difficulty breathing, difficulty swallowing, impact of daily life, and function. What I found very interesting was the very question that you brought up.
Can you keep it up when
Oh.
someone wants to take a picture?
No, that's okay.
Thank you so much.
Oh, no, go right ahead. We're not in any hurry here at all. And we're,
The polymorph, yeah, that one.
yep.
Oh, you did. Thank you.
Okay.
Sorry.
No problem. Anybody have any questions, just stop me.
You could find that in the Blue Book, or can you?
Yes.
Can you just
And
go to
actually-
Social Security?
Well, actually what you would do is type in Social Security disability myositis. And it will pull up the disability site and you can read through everything yourself. It'll take you right to section 14.00 and then you can read through the whole section. It's fairly long, it's not particularly interesting, but it's very informative. There is no specific listing.
You were talking about a question,
Yes,
you didn't finish.
that's what I'm getting to right
Oh,
now.
okay. All right.
That's okay. These are different types of myositis that are not specifically listed. They are included, though, under section 1400. They have to be documented by the physician, the specific condition, why they feel the criteria. Part of the reason that I found an interesting article on why IBM is not included under Social Security disability. IBM typically is thought to be a disease for people that are older. I was going to say, typically. Then I went and researched, and that's not necessarily true. There's a lot of people that are under the age of 50 that are diagnosed with this. What the reasoning why they're at the time, this article that I read said was a lot of people with inclusion body myositis don't become disabled until they're already eligible for Social Security, or for Social Security. So that is why there was not a specific designation. You have to be specifically documented by your doctor. It does not mean that you will not be eligible for Social Security disability. It means you're just going to have to jump through another hoop, basically, or a little bit more documentation.
Excuse me?
can you just clarify simply, if you are less than 65 and you're fully disabled, you can get into the system this way. But what if you're 65 or 64 or almost 65 and are disabled? Is it two different programs? Is there additional benefit, or do you, by being declared disabled, or do you just get your old-fashioned Medicare, your old-fashioned Social Security that you would have gotten anyway?
You could just do your old-fashioned Social Security, because there are benefits to being disabled, yes, and it's not just for this. The disability will also help you with other programs. In the last lecture, we talked about aging in place. There are a lot of programs that are available for people that have the disability or disability designation, in regards to homestead exemption for your house, help with assistance remodeling your home to make it available or accessible for handicap. So if you are disabled, you really, it's in your best interest to have that disability designation.
Even if you're 65?
Yes,
doing
just
second
for other
paperwork.
programs. Because there are a lot of community-based programs, there are a lot of other state-based programs. There are, like I said, programs available for remodeling, for home care, for people who come into your house and help you. So that's up for you to determine if you want to do the.
Can you go back to the 24-month waiting period
Yes.
that you were talking about regarding getting on Medicare?
Mhm.
Did you say that there's no penalty for not having medical insurance? Is that what you said?
If you don't sign up during the period, you do not have the penalty that they were assessing if you did not sign up for insurance under the.
Like when you're 65,
Right, yes,
you're
thank you.
penalized
As if you
don't
sign up
enroll.
late.
She's saying
Oh,
that
I see.
You have
Yeah.
to wait those
It's
24 months
months.
once you're declared.
Thank you, I
Okay,
couldn't get it out.
okay, so you still wait the 24
Yes.
months before you apply?
Yes.
Okay, thank you.
You go ahead and apply
You
for
apply.
disability. Once you're approved, you
Yeah.
have to wait the 24
4
months
months to
for the
get it.
Medicare to kick in.
Yeah.
So
Do-
you want to try to keep whatever insurance you currently have.
Sure.
Because
Until you get
you're going to
that.
have to wait 24 months until your Medicare kicks in.
Right.
Do you have to sign up for it, or do they automatically, after those 24 months?
They automatically.
Oh, great, thank you.
When does the waiting period start when you apply for Social Security,
That's when it's approved.
or when it's approved?
But your
Yeah,
payment.
but they retroactive it.
Yeah.
Oh,
The date of disability?
retroactive. Let me give you, everybody, a really important thing on retroactive, okay? And this is a complete side note. If you are retroactively approved, that goes, say for instance, you get approved in July and they retroactive you till January 1, all of the bills, medical bills you've incurred for that 6 or 7 month period, someone has to pay back. Because if it was paid out of your private insurance, they go, well, you weren't disabled from January, or you weren't on our insurance from January till June. You've been retroactively approved. So there's 6 or 7 months that you will have to go back in and refile all those medical bills because someone wants their money back. Our company just dealt with a case of someone that got approved for Social Security disability in July. They retroacted them back to January 1. Their insurance company sent the specialties pharmacy a bill for $150,000. Because the insurance company goes, we weren't covering you. You were covered by Medicare. So when you do the retroactive, make sure that you are ready for the paperwork battle.
So when you get Medicare, so this is really about when you get Medicare. When you get Medicare, when you wait the 24 months, they may retroactive it back 6 months.
Yeah, they can.
They can, and then so those 6 months that they
That
go
you were
back
covered, that you were covered by another insurance.
whether it's your own personal insurance, company insurance, doesn't
Right.
matter. Somebody else is gonna want their money, so you
That
have
the,
to.
correct. The example was this person that got retroactively worked for a school district. The school district is a self-insured entity. The self-insured entity had paid for IVIG for 7 months. Medicare came in and said, we retroactivated you back to January. The school district said, if you were covered retroactively, those 6 months we paid for IVIG, someone owes us money. Because you weren't insured by us, you were under Medicare.
I guess that'd be a problem if your private insurance or whatever covered different things that Medicare doesn't cover.
That's the point, is where it
And
becomes
then
a
you're
problem.
caught holding the bag.
So then you have to pay.
And that's one of the things I always try to tell patients, if you can get approved early in the year, because it's a lot less paperwork nightmare.
I have a question. If you have Social Security, disability, and the Medicare component, but you're younger than 65, when you reach, I don't know if it's the 2 years before, the year before, does that change when you become 65, or do you just keep it for life?
You just keep it for life, I believe. Yeah.
Does it expire? Like, can you always, like, if you're gonna need social security disability, like, I'm 25 and I have it, like, does it ever?
You have
expire?
SSI though.
I have a disability,
You have disability, okay.
so how does that work?
You have to, you continually resubmit your doctor's forms.
It's every 3
3
years they
years,
go
yeah.
back and,
They
for the state of
will-
California.
They will submit to you, if they
Yeah.
want to
Yeah, you will send the
like,
paperwork.
they'll send it, you know.
Yeah, you'll know about it, trust me. It's kind of a stressful period. Questions to determine disability. Are you working? Is your condition severe? Is your condition found to be on the list of disability impairments? Can you work as you previously did? And can you do any other type of work? That is going to be one of the big questions, whether you're found completely disabled or not, is can you do another type of work? Be prepared to be denied. That's the first thing I tell everyone, is if you're applying for Social Security disability, don't assume you're going to get it on your first try. I know very few people that have, there are though.
So if they're telling you to do another job that's different from, that you're able to do, and it's not as much money as the other job, is that, you don't have to,
You know what I'm saying?
They don't care what.
They don't care.
They don't care.
You have to be found disabled. And that has to do with the disability listing and what your doctor says you are capable of doing or not, and whether they agree with that or not.
Regardless of the paper.
Exactly,
Yes.
completely regardless.
I mean, that's a huge.
It's a huge issue, it is. If you are denied, you have to appeal the decision within 60 days. People miss that. I don't know how they do, they miss that. And then you're in a world of hurt. If you apply and you are denied, you must file an appeal within 60 days.
And if you don't, you have to do it fresh.
You gotta
You have to
restart
start
the whole
over the
thing.
whole thing. Yeah, it's just like reboots the whole thing, it's just resets.
How long does a typical approval or denial process take?
It can take a long time.
The initial one?
We're coming to that in a minute,
Okay.
yeah. A lot of people feel bad about applying for Social Security disability. I have a number of patients, they don't want to see themselves as disabled. They want not to have that designation. Don't feel bad about it. If you need it, that's what you have paid for. You have paid into the system. You have the right for your SSDI benefit.
There's a question back here.
Yes.
So, back in 2012, my wife was okay for Medicare, but we decided not to use it because I had private insurance. And so now we're getting close to retirement age. So are we gonna have to because we just didn't use it even though she was okay
I
for it.
believe you'll have to
We
redo
can have to
everything.
redo the whole thing.
Have they sent you any other letters on redesignation or
Well,
reapproval?
she just went to all the Social Security people, so we're in the process of that, but we're just trying to figure out.
You're actually the first person I've ever heard say that before, so.
Well,
Well,
yeah.
Why do you need?
so, excuse me, but I mean, I think there are a lot of people that apply for Social Security security disability and get social security disability that are under 65
Yes,
and qualify for Medicare, but opt to stay on their
on their
spouse's
private,
health
on their private
insurance.
insurance.
Because you're supposed to, if you,
Yes.
because, number one, there are a lot of doctors that won't take care of you if you don't have Medicare.
And that's
or
the other thing, it
benefits
depends
and-
on if you're on.
You
and-
can keep your Medicare as your primary
Primary.
and your private
Right.
insurance as
Is
your
your
secondary.
secondary.
Okay,
or
but a
vice
lot of
versa.
people keep their spouses as their primary because it's much better insurance.
Medicare is always
And-
gonna be your primary.
No, it isn't.
No, it's
No, it's
not.
not. So, but I'm just saying that there are a lot of people that do that and keep their spouse's insurance as
Yes.
long as they can. And their
Right.
spouse is 64 and saying, okay, my spouse is gonna go on Medicare, I better go on Medicare now. So if they never applied for Medicare, they basically, as long as they've gotten the disability designation,
But remember what they.
you still have to do the
You have to
2-year
s-
look back again?
Yes.
Okay.
So I think some people get it confused. Social security is income, it's not insurance, right? It's a policy you
Yes,
take
this is social
for
security
income,
disability,
and then Medicare is your health.
is your health insurance. They're completely different things.
So people leave them together, but they're separate.
They are. They are completely
Because
different.
it was the Medicare part. that
Right.
wasn't.
Okay, now, the other program is SSI. SSI is social security disability without the having worked. The SSI targets eligible people who have limited income and resources, who are disabled, blind, or age 65 or older. Unlike social security disability, SSI does have asset and income limitations. Serious ones. You really, you can't have any assets. Yeah, no, you can't. Social security disability benefits, also known as supplemental security income, include benefit payments made to the blind, elderly, and completely disabled individuals who have demonstrated financial need. Social security disability benefits are funded by the U.S. Treasury. They are funded differently. SSDI comes out of Social Security and what you've paid in. SSI is funded out of the general U.S. Treasury. And it is based on financial need combined with a disability. Rules for SSI are completely different. A person has to have a low income and low assets, less than $2,000.
Total assets?
Yes. Yes, you can't even own a car.
Or
Okay.
yearly?
It's assets.
If you're married, you're pretty much out of luck.
Well, you have to remember, folks, this program was designed for people who were absolutely
Yes,
destitute.
yeah, I was gonna say
It's
that's
not
what
for most of the people in this room.
Yeah, no, this is for people that have nothing, or that, I mean, I worked with a lot of people that have children that are never going to work. They are never, maybe even going to be out of an institution. That's a lot of what this is designated for, is people that have no assets, no ability to earn money, no ability to gain assets, or even if they have them, necessarily manage their assets.
And probably never will.
Exactly. SSI is a needs-based program, whereas Social Security disability insurance is a benefit. There is a difference. If you have SSDI, that is a benefit that you have, I don't want to say earned because you have earned that, but it is completely different than SSI. These are people that will never be able to earn that. Medicaid. Medicaid is a jointly funded federal program with health insurance programs for low-income and needy people. It covers children, the aged, blind, disabled, and other people who are eligible to receive federal assistance, income, and maintenance payments. SSI and myositis. There was not that much information on this because most people with myositis are not disabled when they're younger. Most people with myositis have worked and paid into the SSDI, into the system. if you do have myositis and you have never worked, or you have not worked enough to be eligible for SSDI, this is where SSI comes in. If you were married your entire life, did not work, did not pay in, and have myositis, you would be eligible for SSI.
But
Assets.
they still have your assets because
That's-
you're tied to your marriage.
But it's not unless your spouse dies and you're destitute. But on SSI, this is what you will, oh, there is one other thing. If you are younger and you do have, like you, SSDI, and you paid in, but it's a low amount that you receive every month, you may also be eligible for SSI, depending on what your assets are.
This is SSI.
I know, but I'm talking,
Okay,
yeah,
I'm
but
asking, this one is SSI?
yes, this is SSI. This is all you receive on SSI.
And how do they determine what assets are hers and not her husband's?
Well,
or-
it'd
They don't, it's both.
You're a couple,
Both.
so it's.
It's a couple. If you're married, I know people on SSI that have lived with somebody for 20 years. They have not gotten married because of the asset issue. It's fairly limited. When you should apply. Soon as you are having that discussion with your doctor. Is it getting time or to a point where I don't know if I'm going to be able to work? Or your doctor's saying, you need to really think about where you're going to be in a year or two with your disease state. That's when you should start thinking about applying for SSI, or SSDI, pardon me. Don't wait, because it can take a long time to get SSDI. And it is a complicated process. Start the process. That doesn't necessarily mean file the paperwork tomorrow. That means start the process. What do I mean by start the process? Speak with your doctor. Start documenting everything. The government loves paperwork. The government loves documentation. And I can say this because before the pharmaceutical company, I always worked for the government. The government loves their paperwork. Document all your work restrictions. Gather any clinical data in regards to your disease that you can to include with your packet.
I have a question on that.
Sure.
if you don't mind. I'm currently still working and my doctor has talked to me about start thinking about when to quit working. But every time I give an accommodation request to my work, they accommodate me. So
That's going to be tough.
how do you decide when the time is to pull the trigger, and how do you go from, working one day to not working? How do you get qualified when you don't have an incident?
Right back here. Start documenting every time you need an accommodation. Because at some point, your work will not be able to accommodate you anymore.
Like when you can't get out of bed, I guess, right?
I mean, you know what I told her? She told me this before. I had a job that was like, we're not going to accommodate you for anything, and you must do really well at what you do for them to be offering the
My work
accommodations.
allows me to work from home. I can take a nap during the day. I don't even have to work 40 hours. My job's a travel job.
We're going to kill you.
That makes it traveling. So it's like, I want to go on disability, but how do I?
At the point they stop
Well, remember,
allowing
your
it.
disability payment's gonna be significantly less than how much you make, so.
Well, that's why I keep laying on the couch working.
There you go. But start the documentation process. Do you have a list of all the accommodations that they've made for you? You probably have some plan drawn up in the Human Resources Department. Keep a copy of that in your own personal records. All of that will need to be submitted.
And that's going to make it more difficult to prove I can't work.
No, not necessarily, because it's showing gradual decline in function. That's going to be, you were here when you started, they had to accommodate you here, now they're accommodating you here, here, here. Gradual decline in function. When they can no longer accommodate you, or when you talk to your human resources, and be involved with your human resources department, say, it's getting to the point I don't know how much longer I can work. The gentleman that had multiple sclerosis and I worked together for a year. in documenting everything. His trips to the VA, what the VA said, his disability ratings at the VA, right down to the fact that he wore electrical boots to shock his feet so he could pick his feet up to walk, what the current level was. The disability asked for that. Why can't he get in and do his job anymore? He can't feel his feet, he's a lineman, come on, he's gotta climb a pole. But we had to document every single accommodation and every single reason. This is a question I get all the time. Should I hire an attorney? I'm not here to promote the legal field. There are a lot of reasons to hire an attorney that specializes in Social Security disability. The biggest one is they specialize in it. They know, your doctor does not specialize in Social Security disability. You don't specialize in Social Security disability. They do. What that means is when you have questions like you just asked, how do I apply for Social Security disability? Will they keep accommodating me? The attorney is going to demonstrate through the paperwork chain, declining, function, and need. Like I said, feel free to do it on your own, expect to be denied. Just, most people, the first time through, are denied, even with an attorney. What I get though, a lot of times, is the people that are on their appeals process that still don't have an attorney, don't have their proper paperwork, their doctor's never done a Social Security disability for their particular disease state before. Attorneys are familiar with what you need, the documentation you can help put together. Remember, many are denied. That's the initial application. And what's the time period that you have to appeal that in? 6 years. Because it will restart everything. If you're a year and a half into the process and you're denied and you miss that 60-day cutoff, you start all over again.
I have this long-term disability that I paid into through my job. Okay, so I've been out for a year and a half. I no longer have that position anymore. Of course, I was a good nurse. They hired me back if I'm up to it, blah, blah. So now I was denied. Okay, so I'm thinking about getting an attorney just for the sheer energy of doing everything and those questions. I got a letter from the insurance that I paid into. So, like, yay, it's 60%. Social Security is much less than that. So they want me to get Social Security because then they only supplement the difference up to 60.
Right.
Okay, again, still good for me, right? So I got a letter saying that you have to show me the process or we're going to lower the amount. Like, that I'm in the Social Security process and what's going on. So I did get denied once, but my question is, can they lower me if Social Security denies me? If I'm meeting
I
the
don't,
criteria?
that is your individual
Okay,
I think
policy.
they just wanna see that you're in the process, so like that letter of denial, like for me, I had to send them the copy of the letter of the denial.
It is dependent on the insurance.
Correct, but it's everybody's
following up.
individual long-term care
Yeah.
policy.
So that's where I am right now.
And they actually provided an advocate to help me fill out.
I was going to say, that's the other thing I was going to say, is if you are long-term care, long-term
Right,
disability
yeah.
through a private insurance company, each one of those policies is different. All of them, though, know the process of Social Security disability, and will it be expected that denial letter also, okay? But you, they want you off of that as quickly as they can. So a lot of the long-term care policies do provide advocacy services and help filling out the paperwork for you.
For about $2,500 is what they said initially. Yeah, there was a charge percentage, yeah.
Oh, percentage, well, it may be cheaper than the attorney.
Okay, sure.
Yeah.
Um,
And a lot of the attorneys work on payments, and it would not be, you find the right attorney. Again, what I told in the last plenary was research. Don't just go pick the first Social Security disability, or, you know, you hear the ad on the car, dial 1-800 so-and-so for your Social Security disability. No. Look at their ratings, pick a good Social Security disability attorney if you decide to go that route. because it will only pay for itself in the long run.
So your payment is based on how much you've paid into the system?
Yes.
Your whole working career, or just like the last 6 months?
They go over the last four
For the last 4 quarters.
Oh, the last 4 quarters.
Yeah.
So is your payment on disability the same as what you would get on Social Security if you worked until 65 or whatever? Is it a reduced rate? How do they figure what you do get?
Well, if you work to 65, you would probably paid in the system longer. So it depends on where you were when you got the disability.
So it is not a percentage of what you would have gotten. It could be your full benefit.
Depending on your age, yes.
You can go into the office and ask.
Yeah,
me,
they'll tell you exactly.
If I get on disability today, how much is my payment?
Actually, you don't even need to go to the office anymore. You
It's
can just
actually on
type
the,
in
it's on your
my
statement
social-
too.
Yeah, and it's on your statement that you receive. You should receive a statement every year.
What the disability payment would be?
It's on there.
It's all there.
It's on the internet too.
Yeah, and it's on the internet. You can calculate exactly what you would get. SSDI.
I think SSDI, at least for me, it's higher than it would be just a
Right.
normal retirement.
Right. Okay.
Yeah.
Question.
Good question.
Yeah.
It's probably a really obvious question, I'm just missing it. So if you are on SSDI, do you fall off that when you are 65 Medicare?
No.
You stay on this.
You stay on SSDI.
Even beyond 65 and 66?
Because you are disabled. It's a
But
different.
doesn't when you get your full
Full
retirement
retirement
age,
age.
then it converts to regular social security?
Yeah.
Okay, so basically.
But you stay,
And
it's
for me, that's
continuous.
67, I'm not sure how old you are.
Yeah, it's continuous. There's no,
Yes.
I thought you meant was there a gap? There's no gap. You go from one to the other.
Just
Yes.
So if my husband was approved for SSDI and he would start getting, even though he's under 65, he would start getting Medicare.
After, wait,
2 years after.
2 years after, 24 year. If you stay on the private insurance or some type of insurance in that gap period.
And then what about like our children? Would they get
Yeah.
some form of assignment too?
On the children.
For insurance, for health insurance or something?
It depends on what your income, it depends on what your income level is, and if you fall under Medicaid, there's all sorts of, that one I'm not really sure, but it,
Because if he loses his job, which he's been off of work, but they he's still technically employed, then we'll lose medical.
all right, I would have to look into it. I can be happy to research that for you. Yeah, I'll give you, just come up and I'll give you.
I know, I believe some minor children can get a payment based
but
on their adult disabled
But it's not very
parent.
much.
But no, it's just like a few $100s.
Yeah.
But not a monetary benefit, I'm talking like health.
Right, I'm not sure if they qualify
Insurance,
for
it all depends on the state. I believe you would fall under Medicaid at that point, and
But that's income.
that's income dependent. And, but every state's different on that. California is very liberal. I come from a
Best
state.
state to be in.
Yeah, I was gonna say, I come from a state where you literally aren't eligible for anything. Moved to California and was like, whoa, Medi-Cal. It's completely different.
You said the amount that you're, of SSDI that you're eligible for is based on the last 4 quarters, what, that you paid in?
The 4 quarters you pay into the system.
All right, not, not the last 4 quarters, period. It's the
No,
last-
the 4, yeah.
Last 4 quarters that you paid in.
So then based on that, like, I just left a really good paying job because I physically could not do it anymore. And now I have a job that's probably about half the income, so should I apply now then?
Yes.
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 Yeah.
Okay.
Yeah, no, that might, how long have you been at the new job?
Just about a month and a half.
I would apply immediately.
Right, but they do it on the last 4 quarters.
That you,
Whatever your,
quarters
whatever your
report.
W-2 was in the last 4 quarters, that's what they're
Yeah,
gonna report it in.
4 quarters is a year.
So I get more money.
But there's a maximum you can get on
There's-
Social
well, yeah, there's a
Security,
maximum.
so you might be maxed out either way.
Yeah, no,
depending upon your
there is a
income.
maximum amount, but most people don't hit the maximum amount, honestly, when if they're going.
1%.
Yeah, I was gonna say, if you're fortunate enough, you hit the maximum amount. It's like, one of the questions I came across was, how much interest income can I have on my savings plans? I'm like, well, you're worried about the income limits and you don't, on your interest, you're probably not.
So what is the maximum that someone gets paid if they maxed out all the time? What is the maximum social security?
I don't honestly know that benefit.
It's $2,600.
Is it 26? Yeah, it changes every year based on cost of living. If the maximum amount allowed change based on inflation, so whatever that increase would be. A lot of statistics I pulled were from 2 years ago, and that amount might be different now.
I don't know if we're gonna get to this possibly, but appeals. So he was denied, I submitted an appeal, the reconsideration was denied. So now I guess I have to go to an administrative law judge. And on the paperwork it asks, do you want to have a hearing? Like a box, yes, I wanna have a hearing, or no? Does that,
You know
is
what,
that
I'm
official? Or?
going to tell you, I am not going to advise you on that.
Oh, okay.
Because if I advise you on that and you get denied, then I feel that I might have some liability there. That would be something that I would speak to an attorney about. And if you cannot afford an attorney, there are a lot of programs like Appleseed that can help advise you on that. There's also, oh, hold on a minute. Great resource just opened up, and I found out about it when I was actually researching something else. Hold on a minute. Got my notes here on it somewhere, because I literally was like, I had not heard of that. Okay. There is a very, very high-rated disability representation company. It's called ALSAP, ALLSUP. They have partnered now, and I brought it up briefly in the last presentation on aging in place, because they work with a group that helps elderly and disabled, the St. Vincent de Paul Society. They are partnering together on a new program that was just launched in 2016. It's in its first year, working with individuals legally to help them get their Social Security disability. Now, I had not heard of the program before. I researched it a little bit last week. And it's just starting, but they're working together to help people that have worked and paid in who are being denied. So that might be a good resource for you to look at, but there's two things I won't do. I won't give legal advice and I won't give medical advice. Beyond that, I'll talk all day long.
What state are they based out of?
That didn't say. ALSAP, I believe, is in every state, and I believe there's chapters of the St. Vincent de Paul Society everywhere. And it's a Catholic-based organization working with a disability group.
If you're on long-term disability, are you required to apply for SSDI?
Corporate long-term. Corporate, yeah. They're going to want you to.
And if you do it later, get denied for a while, and your long-term disability is 60% of your income, if that 60% now, is that where your income is based on 4 quarters? If you don't apply or get approved for a couple years?
So it would be based on your work.
100%?
Yeah, it'd be based on 100%. I have a lot of patients that are on that for long-term disability, trying to figure out what they're doing. And they've applied for the Social Security disability, but they're also exploring all of their options.
So,
Oh, the other thing, and like I said, there are job training programs. If you get on SSDI and want to transition into something else, there are programs that they will help you with that. And you can always return to the workforce, and you can still continue to earn some income.
Yeah, just one thing on the long term. I was told it's the last month's earning is based on for long term at 60%. Question though, I'm a little confused on, having myositis, IBM in particular. It's gradual decline. Do you quit working and then apply, or do you apply and continue working until you're approved, or?
I would, it's always
I
a
mean,
decision, and that's when I say,
because if you're applying, you're supposedly disabled and can't work, but you're still
You
working.
can be partially disabled.
you can be partially disabled, but that's where you
Do
get
you
into.
still get benefits?
You can get partially.
Yeah, that's where you
Oh, really?
get into the declining function.
Right.
The doctor needs to be documenting everything and needs to say, I project my patient will not be able to work longer. And there may be, if you're on long-term disability, does your job have long-term disability? When you are eligible for that long-term disability at your job, apply for the long-term disability and apply for the Social Security disability at the same time. They should be kind of going hand in hand because you'll get the one way before you get the other.
But whether you stop working or not, it's sort of a,
That's up to you and your doctor. And the big thing I'd say is don't wait until you can't drag yourself into work that last day. Because then it's too late unless you have a lot of sick leave and vacation built up. Like the gentleman that I referred to now multiple times, we actually took the municipality that I worked for allowed me to do this for him. People were able to donate sick leave and vacation time. So everybody donated 5 hours that could, and that covered him for the 6 weeks that it took to get to the long-term disability. But if you are in a position where you know you're gonna have to go on long-term disability, be financially prepared for a gap, or have sick leave and vacation built up, so to cover that gap. Because there may be a gap before you're approved for the long-term disability, and you don't want to miss your mortgage payment for that.
So once you get approved then, you can still continue to work?
With SSDI, yes, you can. But you can, now remember, if you are on long-term disability for a private insurance, they will most likely not allow you to work at all.
Okay, what if you don't have long-term disability?
If you're just on SSDI, you can return to work for a certain income level. Yeah, you need to look at the amounts.
Is that different in every state?
Yes.
Okay, that's what I thought. You have to go to your office, find out. It's not based on
not
hours,
Yeah,
it's
based on
dollar
income,
amount.
dollar amount. Like I've got, one of my patients moved from Missouri. Yeah, Missouri to California. In Missouri, she was only allowed to make $1,000 a month. She's making more, she can make more on the type of disability she has out here. It just depends on, you need to make sure that you are
It's not a lot,
researching
though.
state. No, it's not.
It's usually
It's not enough to
less
live
than
on.
$1,500.
Yeah, it's not enough to live on.
What is it?
The amount that you can return to work for.
Oh.
It's supposed to supplement your income. It's not, it's supposed to supplement your disability income. And again, SSI, you cannot work at all. Any other questions?
So I would, if I look at my statement, Social Security, that would tell me then what I look at?
Yes.
That one? Okay.
Yes,
So I
it
just
should be
figure
on,
out-
every year you get a form saying how many quarters you've made into, what you'd be eligible for. It should include SSDI there also. And you can, you can go on the website for Social Security Disability, and they have a disability income calculator. And you input what your quarters were, and it can tell you exactly what your payment would be.
So you don't know any loopholes with the amount is the amount? As
The
far
amount
as
is the
like,
amount, yeah.
the amount you can, earn a month per state?
Per state, I don't know any loopholes on that.
Sorry, does that amount change if you deny the insurance?
Deny the insurance, no.
The only thing that changes would be the long-term disability plan.
Yeah, that would be it.
Long-term.
And each
So
long-term
your
disability
yours
is.
is
Total
fixed.
amount's still the same.
Yeah, from Social Security, it's a fixed amount, whether it's $1,500, $2,500, $26, whatever that dollar amount, and then they only increase the cost of living like $2 or $3.
Yep, it's not much.
And you're gonna pay for your Medicare, they're gonna pull that out of your payment every month.
And you will be
Part
paying
B.
taxes if you're at a certain level. That's another thing people don't realize. You will be paying taxes, depending on the amount you receive. And a lot of people think that it's tax-free. It's not.
but I'm told your long-term disability, if you're paying for it as extra insurance, it is not taxable.
That isn't, but your income that you receive can
Right,
be
just the
taxable.
gap, yeah.
Yeah, the gap.
So, I hear like a lot of people saying, he's newly diagnosed, but I hear a lot of people talking about going in and out of remission. And you're saying SSDI is something you can go on and off of? Not easily.
Not easily. No, don't take it easily.
That's what I was gonna ask you, so would you have to start all over
Yes.
again? If you went into remission, I mean, could you still stay on SSDI, or do you go back to work and then start all over again if you go?
You will receive letters periodically where they will want you to go in and submit documentation in regards to your disability through your doctor. I don't know what would happen if you were in remission when you went in. That would be between your doctor and how you document that.
There is something
what
called
qualifies
ticket to
as
work.
remission.
Right, what qualifies as remission.
They have time, they have time.
There's
like
ticket to
20
work
years,
too,
something.
which allows you a 9-month trial
Trial
period
period.
where you can be working and receiving your disability. And
Yes.
after those, at that point, you can make a substantial chunk of money. But once those 9 months are up,
Then you
if
have to
wanna
either quit or
continue
stay on
working,
it.
you've gotta say goodbye to your disability.
I was gonna say, and I deal with a lot of patients that do that. They'll try to go back to work, and they do give you, it's 9 or 10 months, it's 9 months.
I think it's 9 months.
It's either 9 or 10 months that I think it's 9, that they allow you to go back to work full-time, but at that end of that period, you have to decide, am I gonna stay on SSDI or am I gonna quit my job? Or am I gonna keep working?
Do you give the disability check while you're working or not?
For those 9 months, you do.
You do.
But after that,
It's just like because the government wants to incentivize you not to be on SSDI, they, like I said, they do have job training available if you're on SSDI.
But it's your money.
It is your money.
but you've gotta notify them during those 9 months, you've gotta let them know your paychecks. You can't don't just start working and
No,
say,
you've
oh,
gotta
my
talk
9
to
months are now, like, you've got to notify them of everything.
And do not, when you're on SSDI, do not do anything
Without
talking to them and getting a written letter from them. Don't have somebody on the phone go, oh, sure, you can go back to work. Don't do that. That is a big, if you are going to do something, have written documentation that says, I have been approved to work for 9 months. This is what my benefits will be during that period. Because you don't want to go back to work, talk to somebody, said, oh, sure, you can go back to work for 9 months, and then you get a letter saying you're off of SSDI.
You recommended, I'm sorry.
Oh, no, that's okay.
You recommended, or you're talking about California being a very liberal state, and it is. I just wanted to point out that for those people that live in liberal states like that, sometimes it's better to go on the state that they're in, short-term disability. It's not long-term, but like in California, you can go on California SDI, short-term disability insurance, which pays about 65%, which for
But it's
most-
short-term.
Yeah.
While you're getting
But we have to 12 months. And so if you're having flare-ups up and down, that could come in very handy. As 65% is a lot.
I was going to say,
compared to-
I have a number of patients from California that go on the short-term disability. And the good thing is their jobs are protected. Pardon?
Well, for 3 months.
No,
We don't pay until it's
Yeah.
federal employees.
so that's, I'm sorry, I ignored you
Oh,
twice now, I
no.
apologize.
I apologize because I came in late, so if you already talked about this, I'm
Yes.
sorry.
Oh, no, no worries.
So, in my situation, it's pretty darn clear that I'm always gonna be disabled, you know? And I'm curious if it's because of my age or whatnot, that every 3 years, they make me go through this process where I have to prove to them that I'm still sick.
No, everybody has to do that.
Everybody does, okay.
No, and sometimes it's a little more, 3 years. I've had patients go, I haven't received this letter. I think that's supposed to be every 3 years,
Okay.
but that doesn't mean that the federal government remembers it every 3 years. It's kind of like being audited.
Yeah, okay, thank you.
You're welcome, but no, you have to continue to prove it.
Okay.
I live in California, but with my coworkers who have been experiencing the disability, they're not myositis patients, but I find them talking about retirement. So they want to fill up all the papers before they're retired. Is the retirement get affected by that? Or is it not like a silly question? I don't know. Like for
I see what
example,
you're saying, but,
yeah, for example, they'll say, okay, I'm like they came back from an orthopedic problem that they cannot work, and I'm in a medical, they cannot function. Sometimes they'll do modified duty and just do something computers, but they're all RNs. And then they'll say, well, I'm gonna apply for long-term disability because they can't walk as much.
I'm gonna sit down as a
Yes,
pretty cool with that.
And they say it's a little bit more than retirement. And then they say you gotta do it by age 57 or so, because after that, you won't get it. You ever hear that?
I don't honestly know what you're talking about,
I'm
but.
sorry, I'm not very
Oh, no, that's okay.
clear. I don't think I'm clear. I'm just thinking, if I retire, I'm only 55, but I'm looking in the long term. I don't know if I'm still working, but should I start thinking about it? Once I start feeling this decline, I'm able to work.
I think that everyone that has a chronic illness that feels that they might be disabled ought to start looking at it as soon as you start thinking that potential exists. You need to start documenting everything with your doctor. You need to keep really good records, and any type of accommodation that you are given, you need to make sure that's documented. You were talking about them being accommodated. Anything that you ask for that is granted by your employer, you need to make sure you have documentation of it. So start your file now.
Yeah, well, I see them holidays. But some of them, a lot of them too, are declined. And they'll just retire anyway. They lost that income. Or they have long-term disability.
Right. And the other thing is, if it is available and you're young enough and you're still working, take out the long-term disability insurance. That will make a huge difference. I mean, that can save you, and that's usually offered through the employer.
You can't have pre-existing conditions. You can't, I tried.
Well, I think it depends on the company and the long-term disability. If you work for a self-insured plan or like through the government, a lot of veterans coming out of the war have disabilities that are working considered chronically ill, and they're still eligible for long-term disability insurance. So what they do is
but not the private sector, because
what it usually does is exclude you for the condition you currently have. It doesn't exclude you for comorbidities or future conditions.
But I would add
So
to
how do you
that,
fit that in with your diagnosis of like DM? So you have to kind of finagle around that?
You have DM now. That doesn't mean that you won't have something else. A lot of chronic illnesses, you end up with one or two or three.
So like if you got ILD in 5 years, you might be able to get disability
Right.
on ILD or some
Like,
other.
Because my financial person was doing that, I was trying to.
No,
yeah,
like,
and they said that you can't do pre-existing.
No. One of my patients has, oh my goodness, like chronic pain syndrome.
Fibromyalgia.
Thank you. I haven't had enough coffee today. She has long-term disability insurance with a specific exclusion for fibromyalgia. She is on now long-term disability because she has developed severe issues with her gastrointestinal tract that have nothing to do per se with the fibromyalgia, but she is at the moment, she cannot work. She's going to go in and have surgery to resect part of her colon. She is covered under the long-term disability that she took out, but she is excluded from the fibromyalgia on that long-term disability. So a lot of patients with myositis, with like immune deficiencies, a number of other diseases, you develop what's called comorbidities. So you may develop IBS, you may develop a different neurological disorder, you may get in a car wreck and can't work. That long-term disability insurance will cover you for everything except what you were excluded for. And again, you have to look at each individual policy.
the other thing I'd add to that, if you don't mind, is watch, just because you got excluded this time, watch an open enrollment every year. Because one year my employer changed carriers.
And then it's not
And
excluded.
they waived it, and I jumped on that so fast, your
Yep.
hands spinning.
Was there a list of things that are just like, or
they'll tell you that, you know, there's a grandfathered in, or there's a no exclusion period for
Read
medical
all,
exam.
yeah, like I tell
So
everybody,
you
read
every
your
year.
policies,
Yeah.
every, always read your EOBs from cover to cover.
The other thing that I think is important to, sometimes the insurance part of Social Security disability is as important as the actual financial part for a lot of people, and once you're on it, you can maintain the Medicare and go back to work for 5 years. So that would mean that maybe you weren't working your full-time job where you would qualify for your insurance, but you could keep your Medicare. So like I went back to work, but I wasn't working full-time, so I didn't qualify for insurance through my employer. So I had my Medicare as my insurance, but I was still working.
Yes.
So I knew I was never gonna be able to work full-time, but I still wanted to work, so I went off disability, maintained my Medicare, and was still able to work. So that might be an option for some people.
There's a number of different combinations that you can do. We've got time for one more question.
Just a quick question, those of you who have a long-term disability, once I got the Social Security and the Medicare for that, the long-term cut out. And they wouldn't pay anymore. Well, the amount of money they paid was like pennies.
No, I was gonna say, and usually it's the, I've dealt with people that have 2 or 3 different things paying. If you're receiving Social Security disability and you're also receiving veterans benefits for disability, like you're disabled in the military and a percentage, and you have long-term disability, they all work out a percentage of what they're gonna pay. And your long-term disability plan and the private insurance is usually one that pays the least amount to you. You're never gonna make more than 100% of what you were making before.
Thank you.
Everybody, there's a form in your packet. I'm supposed to tell you to fill it out. Have at it.
I'll take them back there.
If anybody wants a card, I have business cards up here to contact me.
My name is Chris Harris. I have dermatomyositis. I was first diagnosed in 2005. So this is my 12th year, and this is my first year to this meeting, which I'm kicking myself for, but going forward, I'll be at every one. My favorite part of this meeting is meeting the patients and their advocates, and I'm amazed at the support that I've received since I've been here from everybody. And I love that people have shared their stories, no matter how challenging, but I love the idea of hope for everybody. And my second favorite part of this meeting is the individuals who have donated their time to move this disease forward and try to find a cure, which includes everybody with the Myositis Foundation as well as the panel. Every person who has volunteered their time, the physicians, the physical therapists, the volunteers, and the fact that they've committed to do this as they move forward is amazing to me. And I love it, and I will be here again next year and the year after that. And it just gives me a lot of hope when I was very depressed. So thank you for inviting us, thank you for supporting it, and I look forward to seeing everybody next year.
Hello, my name is Anastasia Victorson, and I came here all the way from Stockholm, Sweden. I'm very happy to be here.
Is this your first time coming to the Myositis?
To this conference, yes. To the TMA conference the first time.
What's it been like?
It's been fantastic. Very informative. I've met my friends, my Facebook friends, and I hope I'll be able to come again. I have polymyositis, but I also have a syndrome that's called the anti-synthesis syndrome. I have antibodies, a lot of them, but anti-Jo1 is the most common one. And I also have ILD, quite serious. But getting medication, feeling quite okay. The doctor saved my life. Yeah, very good information. And it's also nice to see the persons. I read a lot. It's also nice to see them in real life, to be able to interact with the doctors. Yes, I'm just happy to be here, having met you too. Take care. And everybody else that hasn't been here, hasn't gotten a chance, please try, because this was really worth it. It's beyond my expectations, really. Thank you.
Hi, I'm Doreen Cahoon, and I am on the board of the Myositis Association, and I've been coming to the conferences now for 7 years. I got involved because I lost my father 7 years ago who had IBM, and my sisters, my brother, and I wanted to get involved, and we love every year coming to the conference, meeting new people, and always impressed with how strong and wonderful everyone here is that we meet, and just like being able to help out. So I've enjoyed being on the board. It's a wonderful group of people, all very strong. You know, it's easy in the end. It doesn't take up a lot of your time, and it's very rewarding. So I enjoy it.
So you just heard from my sister Doreen, and I'm Darlene. So Jack Weinsheimer is our father who had IBM. And as she said, we lost him 7 years ago, but coming to this conference every year means so much. I love the people that I get to meet and talk with, and I so wish that my father could have attended. I know that he would have loved getting to be with other people that had IBM just to talk about the experiences that they're having. So I look forward to this each year and just helping, and I just love the people that I'm with.
All right, I'm Alexis Redmond, and I'm from Salt Lake City, Utah. I have IBM, and I am here to meet other people that have myositis and learn from the experts. I appreciate the TMA and everything they do for us.